what is the roles of experts by experience, or EBEs as we call them? You will find that this is just a highlight. We can go deeper, but I know we don't have really the time. But you will find experts in experience, or experts by experience, or with lived experience, so to speak, in providing their experience in international agencies, donor funding organizations. You will find that in the corporate sector. You will find that in academic research. I personally have been involved in research with the university, the King's College of London. I have contributed to the nonprofit sector, to some government sectors. I have used my lived experience in corporate settings to talk about mental health and have and I remember there's a research I was involved in with the Wellcome Trust about 2021, and it was looking at the workplace issue and workplace mental health and stigma, and how it affects people, with lived experiences and in a workplace. So I was brought on board as a person who has a lived experience and who has experienced workplace stigma, and who is willing to engage with people to understand what happens in the workplace. So that was my contribution, and it was they remunerated. And the interesting thing with these, because that was some of my initial engagements in terms of research. I was involved from the onset when they were designing the questions, when they were every bit of it. I was involved. There is nothing that I didn't we didn't cover. I was involved from the process, and that is what we were saying: meaningful and meaningful engagement, not to just bring them on where you want to hear their story and then it's done. They don't know what happens after that. So inclusion in research. Now, this is what I was previously referring to. Like you are included from the start, like development of research questions. Personally, I've been involved in a few projects that I was part of developing research questions. And I was also involved in the planning and development of everything in terms of data collection, in terms of dissemination, in terms of data analysis and interpretation, the whole process. And I have been, I think I have been part of a few of them that have included me right from the start and to the end. And that has actually also made me, as a person with lived experience, actually value my lived experience. I just don't give it out because not it's not something just so free to give out. It's not out there. It's not so easy, And I think being in a position where I have been taken through recognizing the value of my lived experience is also part of why I'm here, to let people know that lived experience in research has value. It should be valued. It should have, everybody, the people with lived experience should feel as included as just any other person in that particular research. So how do you promote meaningful and authentic engagement? Inclusion from the start. It's and this is something I think I have just mentioned, and it's right from the start up to the last bit, even the M&E, monitoring and evaluation phases. And you will find that because initially, and this is what we are trying to change, initially, because people think that as a person with lived experience, I don't really have any value per se. You will find that people will not, or the research team might not include me in such processes. But one thing that we're also trying to communicate in promoting meaningful and authentic engagement in diverse fields is, one, the person with lived experience is just part and parcel of who that person is. So you might choose not to include me because I have a mental health condition, but maybe my professional background is maybe monitoring and evaluation. You just look at the fact that somebody has a mental health condition and you don't include them. So include them from the start, include us, so to speak, from the start. And the other bit is information and communication should be provided in advance. You are dealing with people with lived experience. You're dealing with people who have, who are dealing with quite a bit in terms of managing their mental health, conditions. So make sure that information is provided on time. Make sure that the information is clear. Make sure that any questions that are raised from the information that you provide, that it is promptly responded to, because you might not respond, and you think that maybe the person that has asked you, or the people who have requested for that information, maybe are struggling with anxiety, and you might not have an idea of the kind of torture that that person is might be going through, or that group of people will be going through. Understanding, why are you not responding? Why have you not said anything? And I ask the question, did I make a mistake? Was I wrong? And it becomes a whole cycle. So it's good that the responsibilities and expectations are well laid out, and information is properly communicated and cascaded in the right manner. There is also promoting well-being. Of course, you need my input in your project, or you need lived experience input in your project. But there is more to that input, and there is more to that than just there is more to that, because this person you are engaging, or this group of people that you're engaging with lived experience, these are people who have their lives, they have other things. So it's not that they are just there today and tomorrow for the next 6 months, just waiting for you to just, they have their own lives outside that. So it is important for you to, for the research team and for the research project in general, to understand that we need to be able to promote people's well-being. And this now brings in the issue of reasonable accommodation. Reasonable accommodations, we are looking at, you are in Kenya, your research project is in Kenya, I'm in the States. Our differences, that is one thing. We are looking at understanding that maybe my medication works very differently. So you want me to wake up at 6, but even if I sleep at 6 in the evening, I'll still not be able to wake up because of my medication. Does that mean that I cannot contribute to research? No, that means that we can have some reasonable accommodations based on, and reasonable accommodations are mostly individual based, because what I might need because I struggle with ADHD might be very different from who has bipolar. Yet, so we need to understand that, even as we include people with lived experiences. So we look at having a safe spaces for engagement when you have meetings, or when we are in the process of conducting research, and such aspects. And then we go to look at resources and support. We must have sufficient resources, logistical support, accommodation of allocation of reasonable, funds to earn financial compensation for people with lived experience that align with equal pay for equal work. You get, and this is very important. It's not about just the money. It's about are you providing some of these resources? Are they sufficient, or have you just budgeted for the people you consider to be core in terms of the research, and the others is just like a miscellaneous cost? So logistical support. Here we are talking of things like meetings, time differences if you're having online meetings, language barriers and all of that. We are talking about transport if people have to move from one location to another. We are talking about getting access to hotels that might cater for people with lived experience, maybe physical disabilities or psychosocial disabilities. These are some of the things that we are looking. So it's more than just financial compensation. It's a lot of things that would affect a person with lived experience.